Let's now get right into our discussion of the night. Tonight on The Insight, I'm stepping in for Victor Muyakane, and our conversation tonight is about the nexus between climate change and health. Our guest tonight is Dr. Kenneth Kigundu. Dr. Kenneth is an environment and climate change expert in Environment for Development Kenya. Will be telling us all about that. Karibu sana, Kenneth.
Thank you so much, Anne.
Kindly do us the honors to tell us, what do you do at the expert in actually the EFD Kenya? Tell us about that. I almost butchered that.
Yeah, thank you so much for having me in this interview. So EFD in full is Environment for Development Kenya, and this is a research center based at the University of Nairobi, and it does policy-related research on environment and climate change related issues. More specifically, we do research on energy, agriculture, forestry, climate change, and also bring in the issues of health. Mm-hmm. Yeah. Interesting.
Now, I understand that currently you are doing research about the impact of climate change and health, which you mentioned is still ongoing. But just now, in general, what is actually the impact, the correlation between climate change and health in general?
A good question. So, you realize that in the last 1 or 2 years, climate change and health nexus has attracted attention internationally, regionally, and even locally. There's this feeling that climate change is directly impacts on health. And at the center, we are currently carrying out a research trying to link or trying to find out how climate change issues and health issues are linked in the context of Kenya. So it's an ongoing research, and shortly the output will be there, and we would share with you. Mm-hmm. But what we are observing at this stage is that probably the climate change and health nexus is not so much incorporated in our policies. Yeah.
All right, so why do you think it is important for us to have this conversation? There's to really just get the country knowing about these two relatives, health and climate change.
Yeah, so for quite a number of years, we have been talking about climate change. And climate change is mainly manifested in such issues such as flooding, drought, abnormal rains, and what we have not been previously doing is to link climate change to health. Mm-hmm. But if you look at, for example, the last 3 or 4 years, we have been experiencing frequent disasters that are related to climate change. Mm. And these disasters are having implications on health. For example, just look at what the country has been going through in the last 1 month or so, mm-hmm. where the flooding. So flooding is likely to be linked to waterborne diseases. Mm-hmm. And as you know, we experience cases of cholera. So cholera at that point was a result of climate change. If you look at about a year ago, we had drought in Kenya. So what happens when there's drought? Mm-hmm. Number one is that there's food insecurity. People are not able to get the diet that they're supposed to get, and therefore we have issues of malnutrition. So that's a case of health issue being directly related to climate change. Mm-hmm. So the frequency in which we are having climate change in the country and even across the globe is causing implications on health, and therefore there is need now to look at the climate change and health nexus in order to bring up solutions to this issue in a multifaceted way. Mm-hmm. Yeah.
So maybe you can tell us, how effective are current policies in Kenya in addressing these now climate-induced disasters?
So what we are observing, or what is currently happening, is that we have climate change actors and we have the health actors. So what we are observing is that these two actors or these two institutions have been working separately, mm-hmm. not in collaboration, and therefore we do not have policies that directly link climate change and health. And this is not just specific to Kenya, but it's also happening across the globe. Mm-hmm. So it's because of the issues of the frequent climate change related disasters that are now bringing this discussion on the table. Mm-hmm. So it is important that you have this discussion so that you can try to minimize the impacts of climate change on health. Yeah.
Tell us about who are the most affected in terms of now, when climate change, floods, for instance, droughts, who are the most affected health-wise? So
the most affected are the vulnerable. Now, look at this. A year ago, or 2 years ago maybe, we had drought in the country. So one of the communities that was affected by the drought was a pastoral community. There was no pasture for their animals. Some animals died, and these animals are their direct livelihoods. Yet these communities have less ability to adapt to climate change. Again, look at what has been happening this year, the flooding issues. So most of the communities that are living in prone areas have been directly impacted by the flooding. So it is the most vulnerable, the communities or the groups that have less ability to adapt to climate change and even to take precaution even when we have warnings, are the parts of the population that are getting highly impacted by climate change. Yeah.
Do you think there are maybe parties, stakeholders that should come in now to address this issue between now health, climate change? What should we do better to help those that are the vulnerable now in this case?
So the first thing is that we need now to realize that climate change is a big issue on health. So we need to bring all actors of the two areas, both the climate change and the health actors, on the table. Let these people, or these two actors, come up with the policies that will help reduce the vulnerability of communities to climate change. So ideally what I'm saying here is that we need to bring all actors, whether they are those in the climate change, those in health. We also need the actors in the finance, because at some point we need financing of some of the climate change and adaptation and mitigation measures. So we need everyone on board. Yeah.
Well, you've mentioned something about now finances. When you're talking about money, right now we're in a season where it's budgeting season, it's finance bill season. What amount of money are you talking about when you say that the government should now provide some funds to help these areas?
Yeah, so I know budgetary issues sometimes tend to be emotive issues because there are so many competing needs. I will not just, I mean, this is not just specific to Kenya, but even across the region. So there is a tendency for our government not to really focus on climate change. But now with the frequency in which disasters are happening and the implications on climate, on health, there's need to expand the financing, particularly that goes to climate change, adaptation and mitigation. I know it is a lot of money that is needed, but we need to do it progressively, step by step, until we get there. Yeah.
How are we doing right now as a country in terms of giving climate change a priority?
Well, I would say we are not doing so badly. At least we can see some efforts towards mitigating climate change. For example, look at what is currently happening in the Ministry of Environment. So there is this agenda to plant about 15 billion by 2032. That already is a way to mitigate climate change. So we are seeing concerted efforts. This should continue until at a point where we are able now to address all the climate change related issues. So it might be difficult to quantify the amount of money that we need to give to this area, but you realize that most of the climate change related issues are likely to be affected in almost all budgetary lines. Yeah.
We're talking about now 15 billion trees by 2032. Kenneth, do you think this is achievable? Are we on the road to that level?
I believe it's achievable. Simply because this agenda has a political goodwill. Yeah. Being championed by the president himself, if they didn't need to achieve this, it's achievable. Because it's all about bringing everyone on board, providing finances, providing the seedlings, and letting the population know the importance of this. Yeah, it should not be left to one section. It should not be left to the politicians. Bring everyone on board.
Right, that's very right. Now, let's talk about floods are here, the drought is here. How can we now adapt our lifestyles now in terms of health, so that we don't get affected with the climate change?
So what we need to first of all do is to accept that this is happening, accept the reality. After having accepted the reality, then we need to take precautionary measures. And at this point, what we can only do is to adapt, because climate change is already there, flooding is already there. So we need to take precautionary measures and maybe avoid, to minimize serious cases of flooding or any other disaster. We need to take care of the communities that have been affected by this flooding or any other disaster, because you realize that climate change is also a big or has a big link on mental health.
Right.
Look at those communities. Look at the affected families. Look at the families that have lost their loved ones. Look at families that have lost their animals, their property, and so on. So these are people who are going through difficult moments. So we need to take care of them. We need to take care of them so that we can ensure that they continue with their livelihoods, even as we address their mental health issues. Yeah.
So what are the long-term health risks when we fail to address this climate change?
The long-term health risk might be devastating. We are likely to, if we don't take measures right now, and not just as Kenya, but across the globe, we are likely to experience more frequent floodings, more frequent drought, more frequent high temperatures, and all these have an implication on health. So if we don't take measures now, the future years, let's say 5-10 years ago, to come, will be very disastrous for the community.
Yeah. All right, now how has the frequency and intensity of floods changed or increased over the years? How are we doing as a country? What is the projection for the future, rather?
The projection for the future is that if we do not take action, the frequency is actually going to be higher. Now, look, for example, the last 3 years or so, we've experienced flooding this year. We experienced flooding late last year. We experienced drought early last year. So you can see the frequency is increasing. And it might continue as such in the next few years. So what we need to do right now is to know how to adapt to climate change. And that now should be led by the government. So we need early warnings so that we can take measures to avoid any vulnerabilities or any impact as we work on long-term solutions. Yeah.
Kenneth, when we were starting, you mentioned something about now the vulnerable being at high risk of being not in good health, rather, due to climate change.
Yeah.
So how does this vary? How do they vary between now urban areas and rural areas?
Well, we are likely to see some differences. The impacts are likely to be more in the urban areas because they are populated. So if there's any disaster, it's likely to affect more people in the urban areas because they have many people as compared to the rural areas where we have less people. But when we come to vulnerabilities, so the rural poor are likely to be more vulnerable because they have less incomes to adapt to climate change. But the bottom line is, whether it's rural areas or urban areas, both regions are likely to be affected by climate change, and the earlier we take actions, the better. Yeah.
Let's now talk about the spread of vector-borne diseases. I understand a disease like malaria thrives in tropical areas. So what is the link between this climate change and vector-borne diseases?
So now, I come from a very cold place called Kinangop. Growing up, that place was a very cold place, and the place experienced frequent rainfall. But for the last maybe 5 or so years or 10 years, we have had some change in the weather patterns. So we are now experiencing some not normal hot periods. Hot weather is a breeding ground or is a good environment for mosquito. And with mosquito, we have malaria. So malaria will be brought by climate change. Yeah.
All right. Now, when you talked about there isn't any policy in regards to climate change, addressing climate change, but do you think that this is a very critical conversation and these policies should be implemented rather?
Well, maybe I would correct you there. I'd not say that there's no policy to address climate change. What needs to be lacking or not good, or not in a good way, is climate change and health policies. Climate change mitigation policies are there. For example, the planting of trees is a climate change mitigation policy.
Let's talk about climate change and health, rather. Okay. Policy for climate change and health.
Yeah. So, climate change and policy, and health policies. So, as I told you earlier, it is in the last maybe 2 or 3 years, but more specifically in the last 2 and 1 year, that this discussion has been happening internationally, regionally, and even locally. And now policymakers are realizing that for us to have synergy, we need to bring the health actors and climate change actors on the table to come up with the policies that address climate change and health. But the question is, where should this conversation start? Should it start at from the climate change desk, or should it happen at the health desk? More proponents are saying that this discussion should start at the health desk. That now we need to, the health actors need to incorporate climate change policies in their strategies. So it has not been happening, and even if it has been happening, it's at a very low level. So it is at this point that now this discussion needs to be taken to a higher level. So first of all, enhance that office, put resources there, put enough capacity there, train people, and as a result of doing that, you are likely to have now strong climate change health-related policies. Yeah.
While now you are championing for the health desk to be at the forefront in creating these policies, what are you doing as people at the environmental sector, environmental experts? What are you doing?
So what we are doing is that we are trying to provide evidence. So we as researchers, we are trying to provide evidence linking climate change to health. Now, you might ask yourself, why would someone consider it important to look at climate change and health as one? If you are told the cost of, the economic cost of health that are brought by climate change, then you're likely to take that seriously. If you are told about the social cost, the health social cost brought about by climate change, you're likely to take that seriously. So what we as researchers are trying to do is to carry out research so that we can get empirical evidence, and empirical evidence is expected to drive policy. Because from the researcher's point of view, any policy that we are driving as a country should be evidence-based. So we are currently trying to carry out research in order to provide evidence. Yeah.
Now we are just talking about floods and drought, but we also have air pollution caused by climate change. And I understand that maybe these ozone layer, the UV radiation, can really cause so much harm to the skin. Tell us about that, Kenneth.
A good question. So, when we have very strong heat waves and very strong radiations, so these are likely to also have health implications on people. Strong heat is likely to be to cause cancer. So again, something that is not well known, but it's there. You know the disastrous effects of cancer. So to a large extent, evidence shows that climate change is one of the contributors to cancer across the globe. Yeah, and not just from the heat waves, but if you look at the, for example, indoor air pollution, countries in Africa where we have a lot of use of biomass energy, and fossil fuels experience a lot of indoor air pollution. And indoor air pollution is one of the leading causes of lung cancer. Yeah.
All right. So, what other factors do you think really lead to these high cost of cancer treatment now, especially for these that are caused by climate change effects?
So, cancer is caused by other factors besides climate change. But the most disastrous issue with the cancer is the cost involved in the treatment. So families experience a drain on incomes. The government spends a lot of money on preventive and curative measures. So these are, these incomes would have been spent on other areas, but now they are spent on health. So we have a reallocation from other key areas to health. And besides the economic impact of cancer, we also have the social impact. If someone, for example, dies, and this is someone who is a breadwinner in a family, then that family is going to go through some income challenges. This again is likely to bring mental health issues.
All right.
This is likely to bring family disconnects. So the multiplier effect is so huge. Yeah.
All right, Dr. Kenneth Kigundu, my director, is telling me that we are out of time. The VAR team is already in studio, but thank you so much for making time for us for this insightful conversation on the nexus between climate change and health. We're looking forward to having you some other time.
Thank you so much, Anne, and let's continue advancing this discussion.
All right. All right, that brings us to the end of our bulletin tonight. Thank you so much for being here. Be sure to stay tuned for the next program, that is the VAR.